Okay, so to everyone, first of all, just welcome here. Okay, and I'm happy that all of you are here. This is going to be a session which is going to be discussing the role of ultrasound, testicular ultrasound in male infertility. All right, so you all know me. There's no point wasting time in introduction. I'll just straight switch to the screen sharing, and once the screen sharing has started, I will just ensure that this screen is now visible to everyone. Okay, and yes, I think the screen is now visible to everyone. So straight go on to the notes and start the session. So please remember, what is important is that when you are studying testicular ultrasound, I'll make the rules very, very simple for you. So one, okay, as an infertility consultant, you are officially allowed to do this. There is no problem inside this. Okay, whom should you ultrasound? That is very, 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 very important. Okay, whom should you do a testicular ultrasound, USG? Okay, so one, all patients of azoospermia, especially patients of non-obstructive azoospermia, all patients of oligospermia. Okay, this is a standard blanket rule. All patients where you have a palpable varicocele. Okay, palpable varicocele. Why I am saying this? Because this is the most important. Varicocele should be examined in standing position. Okay, very, very important. All right. Fourth, all patients who have a high DNA fragmentation index. This is something which is important for you to do, and this is something which majority of the people miss out on doing. All right, so please remember that when you do a testicular ultrasound, these four are your most important criteria as far as testicular ultrasound for fertility is concerned. Right now, there is one more indication which I have not written, but you can really do this in a situation like this, and that is pain in the testis. Okay, due to any activity, if there is a testicular pain, then you must go ahead and you must really end up doing this particular procedure. All right, fine. Now, what is your system of doing a testicular ultrasound? So the best is to use a small part probe. Okay, this is available on all your ultrasound machines. Okay, you can use it on any ultrasound machine, but this is the best thing to do. All right, now what all are you supposed to see in a testicular ultrasound? I'll be playing a live video after all of this. Okay, as I said, I do not want to have a lecture which is going to be more than 15 to 20 minutes, and I'm going to be playing a lecture. I'm going to be playing a video after this. Okay, so you are supposed to look at, okay, so you are supposed to look at both the testis. In the testis, in your ultrasound, you are supposed to look at volume. You are supposed to look at Doppler. Okay. Now, above the testis, okay, just above the testis, you have epididymis, easily visible, no problem at all. Okay. Then you have the vas deferens, and along with that, for fertility, what is very important is to understand the absence or presence of varicocele. Okay, so apart from all these things, you are also going to look at varicocele. Simultaneously, in the males, you have the penis, which is going to be present here in front. Okay, so you have the penis here. I just try to draw it in 3D, and you are also going to study the penile architecture. Okay, now obviously all the problems which are present are going to be very, very easily picked up. This doesn't really require expertise. If you start understanding these 2 points in the testis, especially the volume and understanding of Doppler, trust my word on it, testicular ultrasound is going to be a great help for all of you in patients with your male infertility. It's going to be of absolutely fantastic help. Now, I'm not saying that this is a mandatory investigation, but I've given you my criteria. I have given you which all patients are you supposed to do all these things. Okay, and I'm sure that is going to benefit you when you do something like this. Okay, fine. This report, testicular ultrasound report, please remember, a lot of people try to judge varicocele grade 1 and grade 2, and then they say that there is a grade 1 and grade 2 varicocele. So please remember, you do not have just an ultrasound criteria to operate on a varicocele. Varicocele has to be quantified. Varicocele has to be evaluated with a lot of other factors, especially semen analysis and DNA fragmentation index. And that's when you can look at and judge if that varicocele is going to require any form of surgery or not require any form of surgery. All right. So that is very, very important. Okay. Now, all this being said, now we will switch to our video of testicular ultrasound. Okay. So here I'm just playing the video. See, this is exactly what we like to study. This, what you see here, is the varicocele. So we first normally almost always begin with the understanding of the varicocele. Does the male partner have a varicocele inside, or does he not have a varicocele inside? Okay. Here you can understand that inside this, we are also trying to look at the flow. So we are trying to look at the Doppler inside the varicocele in order to rule out reflux. Okay. This is important. So we want to rule out a reflux inside this. You can see the Doppler which is being performed. And once you can see the Doppler, there is no regurgitation because the wave is not growing below that. Okay. So this is a good varicocele. It's a small varicocele. It's normal to have a small size varicocele. One need not be worried about a small sized varicocele. Okay. That is something which is important and you should keep in mind. So you can see simultaneously a Doppler is being performed. This Doppler is important because it is going to give you an idea of the vascularity which is present inside. And that is something which is very, very important and you need to keep in mind. Okay. You must study both the testes, not just one testis. Once you do more than 100, 200 scans, you will understand what is a normal echo texture. Okay. You will understand very, very beautifully what is the normal echo texture that is present inside the testis. It is not rocket science. Okay. You're going to understand it very, very nicely. This has been my experience. And as a result of which, I'm just telling you that you are going to understand all these things very, very nicely on your routine testicular ultrasound. Okay. Now look at this. We are looking at the size of the varicocele here. This is exactly what we are looking. What size is the varicocele that has presented to us? Okay. So we are looking at that. We are looking at the size of varicocele which is present in front of it. Opposite testis is now being studied. You have to check the testis in 3 dimensions. This is a live scan. Okay. This is an absolute live scan which I am demonstrating. Okay. With a small part probe. Now we will move on to the penile architecture. So here we have the penile architecture which is going to come in front of you. You will notice the penis and you will notice the musculature of the penis. Okay. That is important. You will get a very good idea of the musculature of the penis very soon. Okay. And here you have one more varicocele on the opposite side. Small one. Nothing much needs to be done about it. But you must always put a Doppler in order to ensure that you are going through the right tissue. Okay. This is the penile architecture. As I mentioned, you can see a beautiful penis there in cross section. Absolutely fine. No need to worry. Right now, this is a normal testicular ultrasound which has been done for a patient who has a high DNA fragmentation index. I have sincere request to all my friends who are practicing male infertility, especially, to start doing these type of procedures which are going to be of absolutely great benefit to your patients. Okay, this is not just small benefit, this is great benefit to your patients. Okay, these type of things are really going to help you in your practice. They are really going to enhance the scope of your practice very, very much. Because when you do a lot of dedicated work on male infertility, when you complete this armamentarium, it's going to be really beneficial to your patients. Okay. Any further questions you can put down on the WhatsApp or put down in the chat messages here. My team or myself will be very happy to get back to you. I hope everyone has enjoyed this session. It was a short session, 10 to 15 minutes. Thank you so much.